You're watching 13 News, Kansas News Leader.
It's being called a national epidemic, and it is likely in your home right now. The very drugs that are supposed to make us feel better are fueling addictions and deaths. Just today, the Surgeon General released a first ever report on the crisis. Tonight, we investigate what's happening in Kansas. We are a nation that likes to feel good. No need to live in pain. Don't have to. We have drugs to help. And we're hooked.
For a long time, the policy was no matter what, give people what they need.
Dr. Eric Voth is chief of pain and addiction medicine at Topeka's Stormont Vale.
I think we are all in the medical world sensitized to trying to treat pain and trying to get ahead of pain and keep people pain-free.
But it's had deadly consequences.
The reality is narcotics are dangerous. You take too many and you can easily overdose.
In Kansas, drug poisoning deaths increased more than 121% in the past 15 years. It's attributed largely to the increased use of opioid medications, drugs like OxyContin, Percocet, and Vicodin. In 2015, more people died from poisoning than motor vehicle wrecks or firearms. In young people specifically, the Kansas overdose rate has quadrupled. Only Wyoming saw a bigger jump. And nationwide in 2014, the U.S. saw more than 270,000 deaths involving prescription opioid medications or heroin. That's one death every 20 minutes.
The big trick here that's different is that a lot of the drugs they abuse are legal. And you can get them through legal channels, and it doesn't take a lot of manipulation to get them.
Which is why the healthcare community has launched a whole-scale treatment plan to sew up those loopholes.
We're going to do a patient search.
The KTrack system is one tool. It stands for the Kansas Tracking and Reporting of Controlled Substances Program, a database that captures information on all prescriptions for controlled substances written and filled by participating doctors and pharmacists.
It's just a tool to give them additional information about prescriptions that have been filled by patients that might have drug-seeking behavior, shopping behavior, and so that you can always check in on a patient before you write a prescription or fill a prescription.
Program manager Renee Canton showed us how the information on KTrack offers clues.
30-day supply is only lasting them 5 days, and they're getting another one in 5 days. That is a good indication that you may have a shopper. We have 2 prescriptions that were written on the same day for the same drug.
So that would be a concern.
That would be a concern.
The system also issues an alert if a patient has used 5 doctors and 5 pharmacists within 90 days.
It brings it right up in the doctor's face. This person had 13 prescribers, 9 pharmacies in a matter of 90 days.
Between July and September, KTrack's alerted on 221 people potentially shopping doctors for prescription drugs, giving those doctors a shot at intervening. It could head off addiction before it starts.
Yes. I think it's a way that doctors and pharmacists can help patients who do have issues.
But it's not perfect. KTrack receives more than 16,000 inquiries a day as it shares information with more than 24 states. When it doesn't, Missouri, currently the only state in the nation without a statewide prescription drug monitoring program. Plus, KTrack can't always account for a patient using a false name or birth date. And while Stormont and St. Francis are among systems encouraging its providers to use it, and a White House strategy to combat the opioid epidemic recommends the programs, so far only 7 states mandate it.
Obviously, in the healthcare setting, time is of the essence. And so taking the time to go into an additional system, log in, return information, even though it only may take a few minutes, we're trying to make that process a little bit easier.
Via Christie received a federal grant for a pilot project to integrate KTrack into its computer systems, including its facilities in Manhattan and Wamego. And healthcare systems are taking other steps. In May, the CDC issued its first guidelines for prescribing opioids. In keeping with those, at Stormont, Dr. Voth says patients who receive a narcotics prescription will sign an agreement that outlines risks and refill policies, and it won't be your first option.
If you just had surgery, maybe you'll get a week's worth of some narcotic. In most primary care offices, if you go in and say, oh, my knee hurts or something, you probably won't get a narcotic.
Law enforcement, too, is part of the equation, stepping up awareness of its drug take-back days so extra meds aren't sitting in cupboards, waiting to get into the wrong hands.
Prevention's really got to take place. Everybody needs to pay attention to this.
Now, another reason this is so concerning, the U.S. Attorney's Office estimates nearly 80% of new heroin users started by abusing prescription opioids. They turn to heroin because it can be more accessible and less costly on the streets. While Kansas is not seeing the huge heroin problems other parts of the country are, it is showing up. The KBI told me heroin seizures in Kansas increased 36% last year and are projected to nearly double again this year. Also concerning, synthetic opioids, considered 8 times more powerful than morphine. They are suspected in deaths in at least 4 counties this year. The KBI will be asking lawmakers to get them on the controlled drug list this year. They're not right now. And as for KTrack, its future is uncertain. It costs about $500,000 a year, and right now they get that money from grants and surplus fee funds in the Board of Pharmacy. That all runs out at the end of June, so they're going to have to come up with another way. As you can see, Ralph, a multifaceted, very complex problem. New information coming out every day, and we are going to be seeing legislation in Kansas in January, so we're going to be following up on all of that to see how people are going to work to try and get ahead of this problem before we see the huge happenings here.
Melissa, according to those reports from the government, just today, 78 more people died of their opioid overdoses.
It is a very
from their prescription
real problem.
And addiction. Sure is. Coming up, how a rookie has made a huge impact for the Kansas City Chiefs, Tyreek Hill, and his